Hi, I'm Karima Brown. It's Sunday and it's time for The Fix. Welcome to this edition of The Fix, where every Sunday we hold those in power to account. We tell you what matters, how to fix you, and why you should care. Now, before the regular show, some housekeeping here on The Fix. The Broadcasting Complaints Commission has dismissed Johannesburg NPA boss Andrew Chauke's complaint against The Fix, myself as a journalist, and this channel. Mr. Chauke accused us of portraying him as corrupt and a bad apple within the prosecuting authority. Mr. Chauke's complaint related to one of our shows in October last year. He accused me of seeking to sow division among senior executives in the National Prosecuting Authority by suggestion that he should be subjected to a Mohoro-type investigation in relation to his mishandling of the Jan Mabula case. Now, the BCCSA has slammed Mr. Chauke's failure to participate on The Fix after we offered him the opportunity to do so more than once. The BCCSA says programs like The Fix have opened various dialogues in order to appraise the public of the status quo every now and then. A failure to be part of these transparent discussions would undermine the very public's need for the NPA leadership role when it comes to retention of public confidence and trust. We on The Fix reiterate the invitation to Mr. Chauke to come on the show and put the record straight from his side. Now, since last night, this SMS has been doing the rounds. Hello all. With the rise in COVID cases and hospitals filling up, the Nasrec Field Hospital is still operational, and we have sufficient space and staff to accommodate many patients. Admissions are via 06644262289, and there is no fee to the patients. All is paid for by the Department of Health. Please feel free to share with those in need. Now, this is an SMS that did the rounds. I happened to receive it. We had planned to have the Gauteng Premier on the show, or at least someone from his office, the Health MEC, as well as the HOD to come onto the show. None of the leadership of the Gauteng government is available to talk about this message that was doing the rounds. But I thought it important to continue to shine the light, considering that we are expecting Gauteng to be in the eye of the storm. So instead, I've asked the Democratic Alliance's Jack Bloom to join us on the program. Mr. Bloom, thank you for your time. My understanding is that Premier David Makhura is in an African National Congress provincial executive meeting and cannot be on this program. From the Democratic Alliance's perspective, have you seen this SMS and what do you make of it? Is it legitimate? Have you been in contact with the Health MEC or the Premier's office? What can you tell the public in Gauteng?
Well, this is a very widely circulated SMS and on WhatsApp and various fora. Yes, I have seen it. It's actually, it is genuine, except it doesn't tell the full story. The full story is that at Nasrec there are quarantine and isolation facilities. That's very different from a hospital facility. So there's a section for that, but there is also a hospital facility, but you can only get there by referrals. So you can't just phone up and say, you know, I want to be admitted, I need hospital treatment. You'd still need to come there from another hospital. So yes, I think there is a number to call there. If you need quarantine or isolation, that's where you should go. The difference between the two is isolation is if you have been confirmed COVID-19 positive and you're not able to isolate effectively at home. So that's what it's for at Nasrec. And quarantine is if you've been in contact with someone but you haven't been proved to have it, but you still want to be cautious. So that's the quarantine section. The hospital section, you can only go there by referral. So just to clarify matters, the Nasrec facility is open, but the hospital section, which is oxygen, which is very important, you can only get there via referral from a public hospital.
Now, Mr. Bloem, as the opposition, are you satisfied with the action plan made public by the Premier, Mr. Makura, following President Cyril Ramaphosa's address last week? We have found it incredibly difficult to reach the Premier's office as well as the MEC. I mean, I find it incredible that we are getting ready to receive what is probably going to be our biggest public health challenge to date. And no one from the Gauteng government is, in fact, available to speak on this matter.
Well, that is disappointing, but let me point out a lot of the beds that were promised last year simply haven't been completed. They were supposed to be completed, in fact, in August, September, when they were originally expecting the peak to be. And then we had a firm deadline of 30 November. So there were supposed to be 300 beds at Kopanong. They haven't been completed. Kopanong's in the Vaal area. 300 beds at Jubilee Hospital in the far north of Gauteng. Only 95 of those beds are available. And in the far west Rand, there was supposed to be a refurbished mine hospital from Anglo Gold Ashanti, 175 beds, only 55 completed. The problem is, even with the beds that have been completed, the staff are often not available, they don't have equipment, and oxygen is not available. So I'm afraid to say that, in fact, the promised beds that should have been up and running with staff and equipment are not up and running, and that's why we have these terrible scenes at Steve Biko Hospital, a major hospital, where in fact you have patients treated in tents in the parking lot. And might I say, I think that the beds that were built I think could have been better planned. Surely we should have had extra beds built in the centre city of Tshwane rather than out of the way in Jubilee Hospital, or now they're trying to build beds at Bronkhorstspruit. In fact, those 150 beds that have been promised, I don't think are going to be available at the end of January either, which is when they were told they'll be. So, I mean, the problem is we need these beds now. The staff should have been in place already, and they're not. And that's why I know our existing health staff are feeling terribly pressured, and it's difficult to find a bed in many instances.
Mr. Bloem, are you aware of some of the issues that health workers and unions have been raising? My understanding is also that there's quite a lot of conflict that is taking place at various hospitals, and there seems to be a lack of leadership from the Gauteng Health Department and also from the Premier's office to try and resolve this matter. When the Premier addressed the public in Gauteng during the week, he said that we shouldn't politicize this matter. We should put those things to one side. He appealed to yourselves and the unions to join hands with him. Has he extended this? Is there a public plan that, as the opposition, you can buy into to plug some of the weaknesses? I mean, we know government can't do everything by itself, but I must tell you, from where I'm sitting, it looks like the Premier of Gauteng is completely out of his depth.
Well, you know, he made promises which he hasn't fulfilled. He's correct to say that we have more beds now than we had at the peak of the epidemic in July last year. But in fact, you know, they're not staffed and they're not in the right places. As the opposition, I called for an emergency meeting of the Gauteng Legislative Health Committee. We, in fact, had a meeting on Tuesday, and I had the opportunity to ask questions that needed to be asked. And the information I got was not reassuring, that, in fact, beds were not ready. And we've just wasted huge amounts of money. This mine hospital that was supposed to be converted into high care beds at the far west Rand, which again I think is the wrong location, they've spent about 500 million Rand in it. I don't think it's going to see a single COVID-19 patient. Where the staff, where are this equipment, and the building's not not even ready. And there has been conflict in various areas, which I don't think has been properly resolved. The unions are right to ask questions. The opposition is right to ask questions. Why are we not as prepared as we could have been? The whole point is that we wanted to buy time with all the lockdown measures, which have come at an incredible cost and economic cost. People die of unemployment-related causes. There's been suicides. We bought time because we wanted to ensure that our health services were able to cope with. But let me give you an example. In the middle of a pandemic, they cut the health budget for staff. For community health nurses. 983 community health nurses completed their community service Gauteng hospitals at the end of last year. They should have been reappointed to permanent posts. This is the normal plan, and they've all been let go. So, as we speak, there's 983 newly qualified nurses who we desperately need at the moment, and they can't be re-employed because there's no budget for it. So I asked this question at the Legislative Health Committee, and they said the department is speaking to the provincial treasury. Well, that's far, far too late. This is a major blunder. I understand that we're in an emergency situation now, but certain questions have to be asked, and we need the answers and do what we can with what we have. But unfortunately, I think it's been very disappointing at the lack of preparation that could have been far, far better.
Now, the situation is obviously going to still get completely intense here in Gauteng, given the fact that we have qualified staff that is not placed, we have hospitals that are unveiled with no staff. What is the missing ingredient here? Is it just a question of leadership? Is it a lack of planning? What exactly is the missing ingredient for the plan to kind of be stitched together and be rolled out? We have a message that is going around. Later on in the show, I'm talking about fake messages and misinformation and the damage that caused. That message that went around last night, obviously causing huge anxiety for many people. What needs to happen, Mr. Bloem, for staff to be matched with hospitals, for oxygen to arrive at places where it's required, for facilities to be erected close to hotspots, so that one can actually see, a pattern of interventions that speaks to, the very real lived, needs of people in the province?
Well, it takes leadership at various levels. We've got 36 hospitals, we've got about 300 clinics. But might I say, in the middle of the epidemic, the Premier had to suspend the head of department. Then he dismissed him. He dismissed the MEC for health. We had an acting MEC for health. Now we've got an MEC for health who's only been in the job for 1 month. We still don't have a permanent MEC, a permanent head of department, and various other positions haven't been filled. I'm sorry to say, a lack of leadership on various levels. But honestly, it starts at the top. And what we can do is to address the concerns that have been raised and do what we can. But I'm afraid to say, the provincial government's been caught napping, and it's starting to show. And we've still got a long way to go before this epidemic wanes. I do hope that there's a plan for the vaccine rollout, because that's how we're going to get out of it. But unfortunately, with all the leadership changes, acting positions, it hasn't put us in a good spot.
Absolutely. In fact, capacity for rollout of the vaccine is uppermost in everyone's mind, and of course will be the key ingredient to make sure that it gets to where it needs to get. If we can't deal with the influx and the spike in numbers in terms of infections, we are obviously not inspiring confidence that we will be able to roll out a vaccine effectively, Mr. Bloem.
Well, yes, I think, look, we need a private-public partnership. Everybody's got to do what they can. And yes, the indications are that the government is going that route. And The private health sector must be involved. But please, there are unemployed doctors out there. There are unemployed nurses out there. Employ them. I mean, they managed to find 10 billion rand to save SAA, a failing airline. Well, what are your priorities? Your priorities now are to save lives, employ the unemployed nurses that are out there, the unemployed doctors that are out there, bring this private sector on board. Let's all work together. I know that it's late in the day, but certainly we need to deal with the immediate crisis of the upsurge in cases that we have now. And then we must make sure that we can roll out the vaccine to everybody. And that's the only way we're going to deal with it in the longer term. Absolutely.
That is the Democratic Alliance's Jack Bloom. Thank you so very much for joining me here, talking about the crisis in Gauteng. And I must say, a huge disappointment in the Gauteng Premier as well as the MEC for failing to publicly outline exactly what is going to be happening. It's very clear that the plans that are being made public is simply not shaping up in reality, with mismatching of skills, with facilities being set up where it's not required. So, Mr. Premier, if you are watching, we would like some accountability here in Gauteng before the situation gets completely out of hand. Still ahead, we look at how KwaZulu-Natal is dealing with the rising number of COVID-19 infections. Don't go anywhere.